welcome back to my channel. So today's video, I'm going to be bringing you guys some tips on how to excel in your exams for your Med Surg, adult and elder, fundamentals of nursing, whatever your program calls this class, but it's pretty much the class where all of your answers seem like it could be the right option. You know how you take an exam and you're like, all right, well, A, that doesn't make sense, but B and C makes sense. Well, actually D could be it too. You know, those exams are what I'm here to try to give you a few tips to help you with, because Lord knows that we all struggle with those like tricky questions. And for those of you who may not know, I am in my last and final semester of my accelerated nursing program, and I've also been in a nursing program before that, so I picked up a few tips along the way. So I'm just here to share some with you guys. And while we're at it, I also want you guys to drop some questions down below. I'm going to be doing a question and answer, get to know me type video very soon, so I'd love to hear and answer some questions. It could be nursing related, what I'd like to do in the future, like how tall I am. It doesn't matter. I just want to know what questions you guys may have for me so that I can answer that for you guys very soon. And since you're already watching, you know what I'm saying, join. Okay, subscribe, join the family, give it a thumbs up, and comment down below. Let me know if this video was helpful for you. I'd love to hear it. And while we're at it, let's get into the video. Okay, so like I said, we all will come across a moment in time in our nursing program where we encounter a class called, well, for me, it was called adult and elder, but for you guys, it could be Med Surg, it could be fundamentals of nursing, whatever it is. But it's pretty much the course where it's the foundation of your whole nursing program. But for some, it may be a very straightforward course, and for some, it could be the most difficult course that they've taken. And it's really because those questions are so tricky. But what I've learned is that they're actually not as tricky as we make them out to be. Sometimes we can overthink these questions. Sometimes we can overlook and just not even realize what the question is asking you to begin with. And so over time, I've realized, and I feel like now the second time around in my nursing program, now I'm towards the end, I feel super confident going into these type of exams, because I understand that sometimes, yes, you want to know what the question is asking you, but then you also realize that even if you didn't know what the question was asking you, if you understood the foundation and the steps, you know, to the hierarchy and the priority, I promise you at least 80 to 90% of the time you'd actually get that question right. So since there is a specific priority to things, no matter what the question is, if you know that, you'll always get it right. And I'm telling you this because there's a lot of questions where I may not have necessarily knew the information like 100%, like I wasn't as confident, but I knew that there was a priority to certain things. You know, when you're assessing a patient, there's just certain things that you wouldn't do before the other. So I'll get into that. And let's just start off with the very basic, the very beginning, that I know sometimes sounds redundant and you're like, okay, duh, but sometimes common sense is not so common even to myself. So before I even get into the material, I take out my handy dandy planner, okay? And I go to the calendar section and I literally write down when I want to start studying for my exams. Not just specifically for this course, but for all of them. But for this course, I like to write down, okay, my exam is next Thursday, so I give myself a week. On this Thursday, I'm going to start studying for this exam. And then each day of that week, I dedicate or allocate a certain amount of time to each topic. So let's say that this exam is on 4 weeks of content, right? So we have cardiac, respiratory, neuro, maybe GI, right? So we have 4 different things. So if I have 7 days to study for this exam, I will tell myself, okay, well, you know, I'm not really that strong in neuro, so let me give myself 2 days for that. Or, you know, I'm feeling confident in the respiratory, you know, I feel like I'm one-on-one with my lungs. I feel like I understand the process. So let me just give myself 1 day on that, you know, and I go from there, whatever I feel the most confident about, I spend less time on and I save it for last, because there's no reason to, you know, beat a dead horse off of content that you already know, and it's a waste of time. Time is of the essence, as I always say. So whatever it is that you struggle with or you're the weakest in, you should start first and then work your way to whatever you're most confident in and spend the less amount of time. Because also life happens and you can have, everything written down to the T and like say, hey, okay, I have this amount of time for each topic, and then life happens and next thing you know, you have 3 days left and all this stuff to study for. But if you studied your most weakest area first, then you won't really get the short end of the stick. Hope that makes sense. So that's what I like to do first. And then I save the last day, depending on how tough the course is, maybe 2 days. For pharm, I needed two. But I save the last day just for questions. I can't stress that enough. You just need a whole day dedicated to questions. So after I map all of that out, then I get into studying. Okay? So this video is less about me saying, here's an example of a question, let's answer it together, or these are my notes, because the reality is like the information and that content will come to you. You'll learn that information, but sometimes the foundation, I promise you, it's like, you know how you do SAT prep, and like for those like in high school, you do your SAT prep course and they tell you, hey, even if you don't know the answer, you can eliminate at least 2 options if you know X, Y, and Z. And this is pretty much what I want this video to be, because even if you don't understand the content, you can pinpoint like, you know what, this question is trying to trick me, okay? But I'm smarter and I will succeed. Okay, so number 1, the very most important thing is to know your ABCs, right? ABCs, A stands for airway, B stands for breathing, and C stands for circulation. And if you haven't heard this before, if you heard it before, then you already know what I'm talking about. So airway obviously is first because it's the most important thing that you need to assess in your patient. Breathing obviously is important, and C, circulation. Blood pressure, is the blood flowing through the patient's body, right? So if you're getting a question that says, you know what, you found a patient collapsed on the floor, what is the first thing that you're going to do? They may say, hey, start an IV, or take the patient's vital signs or blood pressure, or assess for to see if you hear breath sounds or something like that, whatever, right? So you may say like, well, dang, like all of these things sound kind of important, but why would I take the person's vital signs if I don't even know if they are breathing? Hello? It sounds so simple after you realize that you got the answer wrong. But sometimes I promise you, when you're taking those questions in that exam, you really are like, nah, son, what do I do first? But it is very important to know your ABCs, because when you know that and you're reading a question, it's like, yeah, you know what? It is very important, because the patient's blood pressure could be so low. Yes, they may need to start IVs and they may need to have IV fluids immediately. But if they're not breathing, if they're not awake, if they're not alert and oriented, then what is that going to do for them? The first thing should probably be like, do we need to intubate them? Do we need to figure out how to get their airway open? So that's why the ABCs are so important. And when you know your ABCs, when looking at a question, you can probably eliminate 2 of those options because they try to trick you like that. Let's say out of all of those options, airway isn't even on there. And you're like, okay, well, I know ABC, right? Ashley said ABC, but airway isn't here. Yeah, so A isn't there, so that means B takes priority. Breathing is now next. Let's say A or B isn't there, and you still have all these options, but circulation is there. Then that's the answer. You know what I'm saying? So when it comes to that specific question. So I feel like me realizing that and looking at questions in that way just like lit up a light bulb for me, because these questions sometimes can be so tricky and volunteer extra information that's not even needed, So for example, what I mean by that is a question in basic terms, like let's say a question is like, what color is the sky? And you're like, duh, Ashley, it's blue. Like, obviously the sky is blue, right? But the question was asked in such a simple matter that you're like, duh, what color is the sky? The color of the sky is blue. But now let's say I change up the question and I say, okay, well, what color is the sky at a 90-degree angle when the sun is just slightly glistening over the grass and there's a little bit of humidity and we're in Vermont and the elevation is about like now when I've complicated the question, you're like, wait a minute. I knew the color of the sky was blue at one point. I mean, at least I thought it was, but now she said a 90-degree angle. So it's like, what color really is the sky? Is it blue? I mean, it could be pink, you know, I mean, it could be gray. Is it cloudy? Was it raining? Dang, the question didn't say if it was raining. You see, like, you go into this like snowball effect where you start overthinking, and that is nursing school. There's something where something so simple that you would know the answer, like something that you studied so aggressively, and I promise you, you will read the question and be like, well, damn, I did know it, but now when they brought that aspect, like, dang, what if the patient, you know, is depressed and they this and that, and it's like, did the question say that, or are you overthinking it? I'm telling you, it's a lot, but we've all been there. We've all thought this, but with certain steps, we can get out of that overthinking snowball effect and come to some concrete answers. Okay, so the next tip that really, really helped me was when I was studying, I would study the normal. And with that, I know, okay, well, if this is what normal is supposed to look like in the anatomy and physiology world, then if I know what's normal, then anything off from that is automatically abnormal. So I know it sounds kind of like, duh, like that's what I'm studying. But sometimes we study, you know, okay, well, this bronchitis, like inflammation of the airway and inflammation of the bronchi, increase in mucus secretions and all this stuff. And we study the abnormal, but sometimes I go an extra step and study what is the most perfect situation, right? What is it? How is this supposed to function? And if I know how it's supposed to function, then anything outside of that, I would read the question, I'm like, okay, the blood is supposed to go here first, not there, because now I see you trying to trick me. So it really does help to know specifically, like, what is it supposed to do. Sometimes when we're studying, they give you, like in nursing school, they give you like, okay, this week we're going to be learning about, I don't know why I'm like stuck in the lungs, but like, let's say like emphysema, COPD, for example. Okay, this week we're studying my COPD. So you'll learn everything about COPD and what's wrong with the lungs, okay? Like, okay, the body, the lungs are, you know, holding on to CO2 and they can't have too much oxygen. Their saturation rate should be at 80%. I mean, you know, it's normally ranging from like 88, 90. So we know all of those things that are wrong, but then sometimes we're like, okay, well, what is the lungs actually supposed to do? How are they? So that's what I mean, because some of these diseases start to sound similar. They start to overlap each other, and you start questioning, like, well, what's the difference between bronchitis and emphysema and COPD? Like, you know, you start overthinking. But sometimes when you just know the foundation, it helps you to distinguish, okay, what's right from wrong. I hope that makes sense. And the next thing that really helps me when studying as well is studying the signs and symptoms. Now, obviously, that's probably what they tell you to do, but in nursing, you're not only studying the disease process and disease pathway, you know, obviously if you're taking pathophysiology, then you really are, but for the most part, when it comes to diseases, like, yeah, they want you to know what pneumonia is. I don't know why, what is my fascination with the lungs today? Like, I can't think of nothing else, like diabetes, okay, whatever. But yes, they want you to know the thought process behind how this illness, how this disease works, but what are the signs and symptoms? Like, what are you looking for? Like, yeah, okay, this patient has pneumonia, now what? What are the signs and symptoms that I should be looking for? And a lot of the times when they're asking you these questions and you get caught up is because like some of those signs and symptoms you may not have 100% like really knew, you know? And like I said, a lot of these signs and symptoms start to sound similar and overlap each other, but it's very specific. It will very important rather to know which sign and symptom is specific to which disease. And I used to study that way and it was very helpful as well with pharm because Again, a lot of the side effects kind of start to sound the same: upset stomach, headache, dizziness, nausea, all of the same thing. You're like, okay, well, how can I differentiate between which drug does what? But when I start to study the drug and say, okay, well, what is the worst thing? What sign would I look for? If I give this person the digoxin right now, what is the immediate reaction that I'm looking for? You know what I'm saying? If I give this person an antibiotic, what could go wrong? This blood transfusion, what could go wrong? And so, like I said, I study what is the most normal, perfect situation, so that if something is not perfect, then I may not know exactly, but I'm like, okay, something's not right here. You know what I'm saying? And then also too, I study the signs and symptoms, because I'm like, okay, well, I know that for digoxin, I need to focus on the heart rate. And if it's less than 60, probably shouldn't give it. You know, certain things like that. So that's to me is sounds common and sounds simple, but I promise you when you apply it, it helps so much. And lastly, when it comes to actually studying, again, I say this all the time, everyone studies differently. Everyone has a different study method. For me, I'm a visual person, so I'm a visual and auditory. So although yes, my instructor just explained it to me, but I still have to go on YouTube and type in whatever it is that I need to further understand. And my favorite go-to is Registered Nurse RN. She's all over YouTube. You can type her name up and type in anything after, and she has a whole lecture and breaks it down. And then not only that, but she has a quiz after that you can take to really test to see if you understood. I also like Simply Nursing. I like Khan Academy too, but it gives me very like science nerd vibes, and I am a science nerd, but like sometimes I need someone with a little, you know, a little spunk, a little jazz in their voice, makes it fun. And Simply Nursing definitely is that. It really helps me, and it gives you like tricks and little like fun mnemonics that you can memorize some of the different stuff, and I really like that. And again, I cannot stress this enough. For me, what I do is practice questions. In this course, I feel like I've done more practice questions than I have actually studying. And you may think like, how does that make sense? Like, but I promise you, there's no way that you can actually really know if you understand the material unless you do the practice questions at the end. I'm not talking about at the end of the textbook and there's those 5 little questions, 10. I'm talking about like 70 to 100 questions to prepare. And mind you, for NYU, there's only 50 questions in 60 minutes. There's never more than that unless it's finals. And depending on the class, they may give you 75, but for the most part, it's 50 questions. But I feel like the best way is to practice, because when you see a topic, you know, a question being asked you about, let's say cardiac, yeah, like I said before, okay, what color is the sky? Yeah, you know the answer was blue. But now let's say I asked you that same topic in a different way and I tried to confuse you. Now all of a sudden you got it wrong. And it's like, how? So, and it goes and it shows you like you didn't really understand as thorough as you thought you should. And so when I start to feel like, oh, I know about this disease, and then I start taking questions and I get them wrong, I'm like, maybe I didn't. Let me go back and review. And so that's how you really can assess how well and prepared you are for this exam. And without those questions, I don't know that I do as well as I did my first time around. In my first program, I would just study. I would just study for, it was called fundamentals in my first nursing program. It's like back 2014. And I would just study, read my book, PowerPoint, study guides, and that's it. But when I would go to take the test, 70s, 78s, 77s, I'm like, yo, like what? I would stay up hours reading the textbooks, studying. That isn't, I'm not saying it doesn't work. For some it does, but for me, it just didn't, because I would still get mediocre grades. But for this time around, when I say I would review the topic, okay, spend the time, review the topic, all right, watch my little videos, and then spend more hours on questions and actually applying it than just reading the textbook, because it doesn't work for me. It may work for you, but for me, and especially in this type of class and course, it just didn't work for me. But don't want to bore your heads off. This is just a few topics, or not topics, but like a few points that really, really helped me. And we can go into the nitty-gritty of the different topics, but for me there's thousands of videos on YouTube that will actually help you to, you know, regurgitate that information. But what's not out there sometimes, I feel like it's just the most basic, simplest content, which is your ABCs, which is, okay, realize like this question is trying to trick you, you know, slow down when you're reading these questions. Don't read them too fast. Like, I like to read the questions, like, you ever see in those like movies or shows where there's like a bouncing ball on top of each word? Like, I'm literally in the exam, I'm like, okay, the patient walks into, no, I break it down because you don't want to read the question too fast. You want to take your time. You want to say, what is this question trying to ask me? You know, you can read it this way and then flip it. Okay, what color is the sky? Okay, the color of the sky is blank. When I reword and highlight, I really spend time to dive in, like, in the most simplest way. What is this question asking me? Oh, who should I see first? Okay, boom. What are my ABCs? Well, this patient has difficulty breathing. That's probably the person I should see first, you know? Oh, well, which is most important? ABCs. Airway's not here. Okay, well, let's check their breathing. That's how I narrow down. And literally in all of my first time around, previous nursing program, C's. This time around in my adult and elder, A's. And again, these are the things that I've changed, and these are the things that I've mastered, that now I'm super confident going into it. So hopefully I could take that same energy into the NCLEX. But yeah, this I live by. Hopefully this would help you. Leave a comment down below if anything has helped you. But yes, that is all. Thank you guys so much for watching and staying tuned. And like I always say, if you're gonna do anything, make sure you do it gracefully. Bye.